Hi, I would like to share with you the two topics that I chose to discuss about the care plan for post-traumatic stress disorder and alcohol use disorder. And my name is Taisha James. Well, the 2 points that I chose was the diagnostic tools and the short and long-term goals related to the diagnosis of PTSD and alcohol use disorder. One of the screening tools they suggested was the PTSD checklist, the PCL-5. This is a self-reported assessment tool used to assess the symptoms and severity of PTSD. It can help monitor changes in symptoms and their response to interventions. 33 or higher with this tool is often used as a provisional diagnosis. It is an appropriate tool to use, but we must remember that this is a screening tool and not a diagnostic tool. It helps identify individuals who may have PTSD and their need for further evaluation. It also helps clinicians make a provisional diagnosis, uh, though a structured clinical interview like the CAPS is usually recommended for a formal diagnosis. It also tracks symptom severity over time, such as during and after treatment. The CAPS, clinician administered PTSD scale, is considered the gold standard. It's a diagnostic tool used by clinicians to diagnose PTSD and to assess and monitor symptoms. And this is also an appropriate screening tool. For alcohol use disorder, the audit tool is the most widely used. It was developed by the World Health Organization, used to assess unhealthy alcohol use that is often defined as risky or hazardous consumption. It is available in 40 different languages and used in many different places around the world, designed for many different healthcare settings um, for providers. Clinicians have to be trained to use this screening tool. Labs was also part of it. So lab testing can be helpful in detecting heavy alcohol use and monitor treatment response. There are direct biomarkers for alcohol use, such as the carbohydrate deficient transparent, and indirect biomarkers such as liver function test, uric acid, and lipid profile, which can help measure the impact of alcohol on the body. Presenting patients with such objective evidence of bodily harm can sometimes help individuals overcome their ambivalence about starting treatment. The LFT's CBC and metabolic panel that was suggested is appropriate in this setting. Alcohol-related medical complications are significant and include alcohol-associated liver disease, which can involve things such as fatty liver, fibrosis, cirrhosis, and alcohol-associated hepatitis. Um, Alcohol affects the entire body, not just the liver, including the brain and GI system, and also cardiovascular and the immune system. Are they appropriate? The short and long-term goals that was suggested from AI, um, they are appropriate, but I believe that they're not very specific. They're appropriate for the diagnosis, but need some like added sustenance. And the Mayo Clinic reminds us that it is important to help the individual develop skills to manage their stress and help reduce symptoms of PTSD and gain control of their fears. For instance, the short-term goal of reduction in symptoms of PTSD. What is needed in that is how. So a suggestion such as what could be added is With the use of exposure therapy or cognitive restructuring, there will be a reduction in symptoms. Also, a reduction in alcohol consumption will be achieved by the individual identifying triggers, attending AA meetings for support, and or starting medication to decrease cravings. The improvement of an individual's quality of life will be achieved with obtaining short-term goals, which can also be considered long-term goals. The long-term goals are more appropriate as achieving and maintaining sobriety is a lifelong task for these individuals. So, reducing the symptoms of PTSD is also a long-term goal, as this will require commitment and work from the individual as they learn coping strategies and manage stress and trauma related to symptoms. The improvement of overall health is also an appropriate long-term goal, as long-term alcohol use often takes a toll on the body and will need to heal, with the individual taking better care of themselves. The National Institute on Alcohol Abuse and Alcoholism informs readers that even a small amount of alcohol has health risk and affect the whole body. My reflection, it took me a whole semester to kind of get comfortable with talking to patients, to elicit information and understand their concerns so that I can help them like process what was going on and how to better understand it themselves. Now that I have a better knowledge base and understand the art of psychotherapy in relationship to the different mental health diagnosis, I am able to help the individual understand the diagnosis and also what needs to happen to obtain positive outcomes. I think motivational interviewing will be a form of therapy that I lean heavily on. I use it a lot in clinical now to help the individual develop short and long-term goals that are realistic and more attainable. So that's what I had to add. Overall, I think the plan was okay. It just needed a little extra added sustenance to the plan and interventions. And these are my references. Thank you for listening.